going to be talking about wheat sensitivity and gluten sensitivity and how it's really being missed a lot in most doctors' offices. And the reason being is that typically when they're looking for wheat sensitivity, they'll do what is called a celiac panel on the blood work. And what that is, they'll look at for substances like gliadin, and they'll look for tissue transglutaminase, which is the enzyme that the body can produce antibodies to. So they'll look for antibodies for gliadin, antibodies for tissue transglutaminase, and potentially they might look for endomysial antibodies, which is an indication that there is damage going on in the intestines. But the problem is that this is a very limited list of what can be going on in a gluten picture. As a matter of fact, they don't tell you this because it is called gliadin, but this is really alpha gliadin. So what I want to do is I want to paint a picture for you as to what's going on with gluten sensitivity and why, if you are suffering from any type of chronic degenerative illnesses, whether it be Hashimoto's, which is an autoimmune disease against your thyroid, or any other autoimmune disease like rheumatoid arthritis or MS or lupus or neuropathies, which are damaged nerves that could be coming from statin drug use or diabetes, you need to be looking for food sensitivities. And when you get evaluated for gluten, you cannot rely upon the typical lab and what they do. And as a matter of fact, there's only one lab that I know of that looks for all 24 markers for gluten. So you do have wheat, and wheat is broken down or has a component of protein, and it has a component of what are called lectins. So wheat has lectins. Some other foods that have lectins are your nightshades, your peppers, your tomatoes, your eggplant, and your potatoes, nuts and seeds, and legumes. They all have lectins. But from lectins you get wheat, germ, agglutinin. So wheat germ agglutinin is a part of the lectins, which is part of wheat. And then on this side we have the proteins, and then from here we have gluten, which is then broken down into gliadin, as well as glutenin. And gliadin, like I said, there's not only alpha, there's gamma, there's delta, and there's omega. It's actually 4 gliadins. On the glutenin side and on the gliadin side, they're broken down by what is called transglutaminase, which is an enzyme. So when a person has celiac disease, there's antibodies to transglutaminase. But just know that then the transglutaminase helps break down the glutenin and the gliadin. I have to write it all the way up here. It breaks it down into deaminated gliadin. Now, deaminated gliadin is something that your body will break down gluten into, and deaminated gliadin is also what is found in a lot of processed foods. So when you see foods that have modified food starch, that's gluten. So things like soy sauce, flavorings, sauces of any type, they can have this processed form of gluten that can be very damaging to the person. Wheat germ agglutinin is associated a lot with painful joints, cold hands and feet. So a person may have a sensitivity to any one of these things. So when they're looking just for alpha gliadin, just one, and they're looking for 1 transglutaminase when in fact there are 8, you must realize you are missing the boat when you're getting evaluated and being told that you don't have a wheat sensitivity or a gluten sensitivity. So I'll get into a few other posts talking about the difference between celiac and celiac or non-celiac and gluten sensitivity itself. In other words, there can be gluten sensitivity without celiac disease. There can be any number of symptoms with any number of these things, and when you get evaluated for gluten in your regular old labs, you're missing the boat, because look at all these other things. You're missing 3 gliadins, you're missing 7 other transglutaminases, you're missing glutenin, you're missing wheat germ agglutinin, you're missing deaminated gliadin. There's 3 isomers of this. So altogether there's 24 markers. You're being checked for 2 or 3, and you're getting missed a lot. So that could be explaining what's going on. Now in other posts, I'll be talking about how you cannot just be eliminating gluten. We'll be talking about how there can be cross reactions to other foods. So I hope this helped at least clarify a little bit of what you're missing when you're getting tested for gluten, being told everything's okay. You're most likely missing out on the total picture of what's going on in your health situation. So I hope you enjoyed this information. I look forward to speaking to you soon, and make it a great day.